Approximately 80% of thyroid patients desire to reduce their weight and do so rapidly. I recognize that many people have a strong desire to return to a normal weight, but I would strongly advise against rapid weight loss because it is almost always unhealthy, almost always causes more thyroid problems rather than fewer, and is almost always temporary. However, this does not imply that all weight loss programs are the same. In fact, quite the contrary is true. For this reason, I have compiled the strongest and most efficient weight loss plans for thyroid patients into one video. Prolonged fasting is the most effective weight loss strategy if you want to lose weight swiftly and healthily. The majority of people do not utilize fasting, which is arguably the most effective weight loss strategy available. Here's where I have to disagree. Fasting offers thyroid patients unique and special benefits that allow them to lose weight without suffering the damaging effects of daily and consistent calorie restriction. Some people will try to convince you that fasting is really just another way to restrict your calories. They'll also try to suggest that there's no difference between fasting and just cutting down on your calories on a daily basis. For example, research has shown that prolonged fasting causes a decrease in T3 and an increase in reverse T3. This is bad for people with thyroid disease because it causes low thyroid function and exacerbates all of their symptoms. However, fasting does not seem to cause these same changes, allowing people with thyroid disease to safely reduce their calorie intake without experiencing a decrease in thyroid function. The key here is to make sure you aren't overfasting, as this can put you in a similar situation to daily calorie restriction and eventually harms your thyroid. My personal experience has shown that most thyroid patients benefit greatly from prolonged fasting. So if you're serious about losing weight quickly, one of the first things you should try is fasting for 1 to 4 days a month. The second thing you should try is cutting back on carbohydrates. I will give cutting your carbs some honorable mention, but with a big disclaimer. Just as restricting your calories on a daily basis can harm your thyroid, so can cutting your carbs. However, I will give credit where credit is due, stating that cutting your carbs temporarily or cycling them may help you lose weight quickly. Although the weight loss you experience when cutting carbs will mostly likely be water weight, it can still help you lose weight quickly if you have an urgent event, like a wedding. It's important to note that this weight loss will mostly be related to a drop in fluid. The weight you lose on the scale won't be a drop in fat mass, and it won't last long. In other words, once you start eating carbs again, all of that water weight will quickly return to your body. There are some advantages to this kind of weight loss, though, particularly if you can use it to kickstart your exercise routine. Sometimes it's just satisfying to see results, and if the shift in your weight motivates you to eat healthier and exercise more frequently, then I'd say it's worth it. However, be careful not to stick to a low-carb diet for too long, as this can harm your thyroid and ultimately cause you to gain more weight over time. This is where carb cycling may make sense, as it can help you benefit from the rapid weight loss associated with that decrease in fluid without endangering your thyroid. Exercise plays a role in weight loss, but the type of exercise matters. Many people, including experts, will likely try to convince you that the best exercise for weight loss is high-intensity interval training, which would be things like Tabata spin classes, assault bike use, sprinting, etc. And while it is true that these types of exercises will help you burn more calories in a shorter amount of time, the magic number is about 100 grams of carbohydrates. This will give enough carbohydrates for your thyroid to function and shouldn't cause those negative effects like a low T3 that I mentioned previously. For thyroid patients, they are typically not the best solution. There is a sweet spot between no exercise and extreme intensity, and that sweet spot is Zone 2 training. Zone 2 training is any workout that raises your heart rate to 60% of your maximum and maintains it there for 30 to 40 minutes. This type of low-intensity exercise happens to be really good for thyroid patients for 3 reasons. Studies have consistently shown that extremely high levels of intensity have a negative effect on thyroid function, even for those with a healthy thyroid gland. This effect is exaggerated for people like you listening to this who already have a thyroid problem. Of course, the first is that it's a low-impact form of exercise that doesn't overtax the thyroid. The second is that it puts the body under less stress, so it won't spike in cortisol the way high-intensity training does. And the third is that a growing number of people find it to be a sustainable form of exercise, meaning you can stick with it over the long haul. Simple exercises like walking on an incline for 30 to 40 minutes on a treadmill will work, but you may do almost anything to raise your heart rate to 60% of its maximum. If you don't want to spend the time figuring out how to calculate 60% of your maximal heart rate, which is actually quite simple, you can also determine if you're in this zone by observing whether you can talk to someone or sing to yourself while working out. You should be able to perform both of these tasks if you're in zone 2. The fourth thyroid medicine is T3. Of all the thyroid treatments currently available, T3 is by far the most effective. Sadly, it is also the most challenging to obtain. When compared to synthetic, it has a far higher chance of aiding in weight loss if you can obtain it. Levothyroxine is an alternative that solely contains T4. You should never use T3 to force yourself into a hyperthyroid state, as bodybuilders may do, but it is safe to take physiologic levels of T3, which can increase your metabolism and aid in weight loss. T3 dosages between 20 and 25 micrograms will work. This is plenty to cause a physiological shift in thyroid function, but not so much that you run the danger of major side effects like bone loss or, in the event of an emergency, atrial fibrillation. If your doctor is unable to provide you with T3, you might want to consider getting T2. Similar to T3, T2 is readily available over the counter and has demonstrated potential in aiding in weight loss. While it is not as potent as T3, it is also considerably more accessible. The recommended daily dosage for T2 is between 100 and 200 micrograms. GLP-1 agonists make up number 5. This is only a different name for the most widely used weight loss drugs on the market today, such as Wegovy and Ozempic. I've been quite clear in the past that because of these drugs' numerous negative effects, I do not advise them for patients with thyroid issues. However, I can't deny that they do work, which is why I've included them here. In one instance, though, I believe it might make sense to use them if everything else has failed and if your current weight is causing you a great deal of psychological distress before undergoing any weight loss treatment or surgery. In my opinion, the disadvantages of PEEP-1 agonists like Wegovy and Ozempic outweigh the benefits for most thyroid patients, but you can decide for yourself based on your unique situation. It may make sense in some situations to trade in the guaranteed risk of obesity and all associated side effects for a potential increase in other side effects associated with the use of GLP-1 agonist. But don't jump in without carefully weighing the pros and cons and doing your own research. If you have tried everything and nothing has worked, does it make sense to just lay down and accept your fate of being overweight forever? No way. We know that obesity causes a guaranteed increased risk of multiple conditions, including cancer. It's up to you to decide what you want to put in your body, but I would recommend trying everything else on this list before using a GLP-1 agonist because these are probably the most effective weight loss treatments that I am aware of for patients with thyroid conditions like hypothyroidism and Hashimoto's thyroidopathy, because the side effects aren't very pleasant. The most concerning of which, at least in my opinion, is that about 50 to 70% of the weight loss associated with GLP-1 agonist comes from muscle loss. This loss in muscle is almost guaranteed to have a negative impact on your metabolism and thyroid function down the road unless you can gain it back. But remember that the best way to achieve the results you want is to follow a consistent exercise and whole foods diet. If you need assistance with this, I suggest watching the video below. Absolutely. By following these expert tips and incorporating the right strategies, you can effectively manage your weight, even with hypothyroidism. Remember, consistency is key, and every small step counts towards your health journey. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends, and subscribe to Health Angel Solutions for more valuable health insights and tips. Your support means the world to us.